Okay, so we are going to discuss the osteomyelitis and septic arthritis station from pathology. A 30-year-old motorcyclist now had a history of tibial shaft fracture, which was fixed using intramedullary nail 4 years back. His implant is now infected and he is febrile, and marked redness and swelling were noted at the right knee. So, what is your diagnosis? Implant-related acute osteomyelitis. Okay. His motorcyclist had a history of shaft fracture, which was fixed through IMN 4 years back, and now his implant is now infected, febrile, marked redness and swelling are noted around the right knee. So basically, this is implant-related acute osteomyelitis, common organism causing osteomyelitis. Sorry. So newborns less than 4 months, Staph aureus Enterobacter species, and group A and B Streptococcus species. Children 4 months to 4 years is Staph aureus, group A Streptococcus species, Kengella, Kengai, and Enterobacter species. Almost same, but include just adding the Kengella, 4 months to 4 years. And then we have the children, adolescents, 4 year to adult. So Staph aureus 80%, group A Streptococcus species, H. influenzae and Enterobacter species, and adult Staph aureus and occasionally Enterobacter species or Streptococcus species. And in sickle cell anemia patients, the Staphylococcus aureus is typically most common, but Salmonella species pathognomic. Like there is a high chance of Salmonella as well. For example, if there is a patient having still the most common is Staph aureus, but let's suppose if you have a patient with osteomyelitis and you cultured the osteomyelitis and it came out to be Salmonella typhi, then or Salmonella species, then you should worry about his sickle cell anemia status as well if you don't know early before. So Staphylococcus aureus most common across all settings. Coagulase negative staphylococci in implant associated infections. So Staphylococcus aureus is the most common, and coagulase negative staphylococci, for example Staphylococcus epidermidis, is also found in implant associated infections. Overall, most common is Staphylococcus aureus, but in implants we have coagulase negative staphylococci. Then we have gram-negative Enterobacteriaceae, E. coli specialate extreme of ages, Capsella species, Salmonella species associated with sickle cell anemia, and then we have the Pseudomonas species, Haemophilus species, H. influenzae considered in non-immunized children, Neisseria species, Neisseria meningitis, Neisseria gonorrhoeae, considered risk factors for sexually transmitted infections, and aerobes fungi cause infection in immunocompromised hosts, and Mycobacterium tuberculosis, atypically Mycobacteria. So we have Sydney classification of osteomyelitis, describe anatomic involvement, host, treatment, and prognosis. So Sydney classification is anatomically, stage 1 is medullary. You can see here this is medullary. Then we have superficial involving the cortex. Then we have the localized, the involving the cortex as well as the medullary, and then we have diffuse involving the cortex, medullary cavity, and all around. So this is another medullary, superficial, localized, and diffuse. So this is all about the what are okay. So this is anatomical classification. Now the host type is normal, compromised, and treatment is worse into patient than infection. Normal, compromised, treatment is worse to patient than treatment. What are the causes of osteomyelitis? Source of osteomyelitis or risk factors. So exogenous, more common in adult, acute osteomyelitis from one open fracture or bone exposed at surgery, chronic osteomyelitis from neglected wounds, diabetic foot, decubitus ulcers, and then hematogenous or blood-borne. For example, there is some infection in the blood, so it reaches the joints and it involves. So hematogenous is more common in children because they are immunocompromised. So we have blood organisms blood-borne organism of sepsis, often positive blood culture before antibiotics given, pediatric immature immune system. So we have metaphysis or epiphysis of long bones, and then we have the lower extremity more common than upper extremity, boys more common than girls, and adults immunocompromised, vertebra most common. So dialysis patient, rib and spine osteomyelitis, IV drug abusers, medial or lateral clavicle osteomyelitis, elderly IV drug abusers, transplant patients. So adults immunocompromised and vertebrae most common. And those adults which are immunocompromised, they have most common osteomyelitis in vertebrae. So dialysis patients, rib and spine most common, in IV drug abusers, medial or lateral clavicle osteomyelitis, and elderly IV drug abusers, transplant patients. So these are all the risk factors. Okay, so what is abscess? We have already discussed this. Abscess is a localized pus or cavity of pus produced by separation by seeding of septic elements or bacteria, or septic seeding of pyogenic organisms. So since pus is also an exudative fluid comprising of dead bacteria, dead tissue, necrotic tissue, and neutrophils. Yes. What is the subacute osteomyelitis? What is Brody abscess? So an atypical form of osteomyelitis which involves a subacute or chronic infection of the bone with the development of localized abscess, usually within the metaphysis of long bones. The tibia is the most common bone involved, and Cephalococcus aureus is the most common organism identified. So atypical form subacute osteomyelitis of Brody abscess is a typical form of osteomyelitis which involves subacute or chronic infection of the bone with the development of localized abscess, usually within the metaphysis or long bones. The tibia is the most common bone involved, and Cephalococcus aureus is the most common organism identified. Definition of sequestrum: dead bone or devitalized bone that has become separated during the process of necrosis from normal sound bone. It is a complication sequelae of osteomyelitis. Involucrum: so reactive woven or lamellar bone deposition forming a shell of living tissue around a sequestrum, or thick sheath of periosteal new bone surrounding the sequestrum. So sequestrum is dead or devitalized bone, and involucrum is reactive woven or lamellar bone deposition forming dead bone or devitalized bone that has become separated during the process of necrosis from normal sound bone. It is a complication sequelae of osteomyelitis. So it is sequestrum, involucrum, reactive woven or lamellar bone. Okay, so when there is a dead bone and it slough off, so there is reactive bone formation. So this reactive woven or lamellar bone deposition forming a shell of living tissue around a sequestrum, or thick sheath of periosteal new bone surrounding a sequestrum. So this is involucrum, and this is this is the sequestrum in the center, the dead bone, and the surrounding hyperdense area, which is the new bone, reactive bone, this is involucrum. Okay, so why pus may burst through the bone? Due to the formation of large rounded cloacal opening in the involucrum, so pus will escape through the involucrum and the surrounding soft tissues to the skin surface within the sinus tract due to increased intraosseous pressure and osmolarity, which occurs due to tissue breakdown. So basically, the pus collected will increase the intraosseous pressure, and this will burst to the involucrum and the soft tissues after the skin. Pathogenesis of osteomyelitis: invasion and inflammation by pathogenic organism, suppuration, necrosis, sequestration of the bone, and new bone formation in involucrum, and then resolution of it. Microorganism enter bone by phagocytosis occurs first. Phagocyte contain the infection, release enzymes, lyse bone pus spreads into the vascular channels, raising intraosseous pressure, impairing blood flow. So yes, they cause ischemia. Then chronic ischemic necrosis, separation of large devitalized fragment, new bone formation in involucrum. Often the body will try to create new bone around the area of necrosis. So this is all about the so they say that, let's suppose infection come here, and then this is phagocytose, the macrophages or whatever the cells, they will release enzymes and they will cause digestion of the bone or necrosis of the bone, and then there will be breakdown, abscess collection, and it will raise the intraosseous pressure, and it will then compromise the blood capillaries and lead to chronic ischemia, and so there will be necrosis of the bones and further superficial infection of the bone, and so on and so on.